Welcome, you have been asked to watch this video as you are coming for either a hip or knee replacement. You may be aware from speaking to relatives or friends that there are different ways of having an anaesthetic for this operation, and during this video we will explain these different options. You may also have previously had a general anaesthetic, spinal or epidural for another procedure. There is no right or wrong way to have an anaesthetic for this operation. There may be factors associated with what the operation will involve, especially if the surgeon expects the operation to take longer than usual, that may affect the choice of anaesthetic. You may have medical conditions which make one type of anaesthetic preferable over another. Equally, you may have a personal preference. This will all be discussed with you by the anaesthetist. Regardless of what anaesthetic you have, you will be looked after by a skilled anaesthetic team whose priority is getting you through the operation safely, giving you good pain relief afterwards, and making sure you're able to get up and walking as soon as possible. All patients are seen in the pre-assessment clinic by a pre-assessment nurse. They will find out about any medical conditions, medications that you might be on, and any concerns you may have about the anaesthetic. You may see an anaesthetist at the clinic to discuss anaesthetic options. If you are fit and well, you might not see the anaesthetist until the day of surgery. Hopefully this video will answer some of the questions that you might have. For hip or knee replacement operations, you may be able to have either a general or a spinal anaesthetic. A spinal anaesthetic involves an injection of local anaesthetic into the area around the bottom of the spine. This numbs the nerves that go to your legs and will leave you feeling numb from the waist downwards. This numbness usually lasts for around 2 to 3 hours. With a spinal anaesthetic, you will not feel any pain during the operation. There will be drapes surrounding you during the operation so you will not see anything, but you will hear the theatre team during the procedure. You can choose to either be fully awake or receive sedation. The sedation can vary from being a very mild dose to reduce anxiety, a middle ground which is like having a deep sleep, or if required can be fully asleep like with a general anaesthetic. The level of sedation you would prefer should be discussed with your anaesthetist on the day. You can bring headphones so you can listen to your own music or podcast during the operation. At the end of the operation, the sedation wears off very quickly, so you should be nice and awake in recovery and able to eat and drink very soon after. The benefits of a spinal anaesthetic include the following. Our experience has shown that the majority of patients do best with a spinal anaesthetic. This is particularly so if you have any breathing problems such as asthma or COPD. The big concern a lot of patients have is being fully awake during the operation, and this can be managed with the use of sedation. In our experience, most patients, if they return for a second hip or knee operation, will ask for a spinal again if they had that the first time round. Other benefits from a spinal anaesthetic include less bleeding during the operation, which reduces the chance of needing a blood transfusion after. Spinal anaesthesia may also reduce the risk of developing clots, or DVT, after the operation. We will run through the risks of a spinal anaesthetic, though it is important to know that it is safe for the majority of patients. One of the most common complications is either difficulty getting the spinal injection into the back or it not working well enough for the operation. The anaesthetist will test the sensation in your legs before the operation starts to make sure it is working well enough. If it is not working, then usually you would be given the option of going to sleep with a general anaesthetic at this stage. Another common complication is low blood pressure, which may occur shortly after the spinal starts to work. This can sometimes make you feel faint or sick. This can easily be corrected with medication. Some patients can experience headaches after anaesthesia. This can be for a variety of reasons, including dehydration or anxiety, but can sometimes be related directly to the spinal injection. This occurs following approximately 1 in 200 spinals, and there are specific treatments that can be given if this occurs. While the spinal anaesthetic is still working, you might not feel the need to pass urine and occasionally may need a temporary catheter placed to empty the bladder. Backache is common after surgery, especially if you have had any back problems previously. There may be a small area of bruising around where the injection was done, which should settle after a couple of days. There is no evidence that spinal anaesthesia causes long-term back problems. There is a small but potentially serious risk of damage to the nerves from the spine to your legs. The risk of temporary nerve damage, which may result in small areas of numbness or weakness, is less than 1 in 20,000 cases. If this occurs, then it often gets better with time. The risk of more serious nerve damage due to bleeding or direct trauma, which in the worst case could leave you paralysed, is very rare and occurs in less than 1 in 50,000 to 1 in 100,000. Put another way, if a spinal anaesthetic was given to everyone who lived in Ayr and Prestwick combined, this may affect 1 or 2 people. A general anaesthetic is an alternative to a spinal anaesthetic. This involves receiving anaesthetic medications which will make you unconscious for the duration of the procedure. A general anaesthetic means that you will need help with your breathing during the operation, which means you will need a tube placed in your throat to attach you to a ventilator. The following are the risks of a general anaesthetic. General anaesthesia is also safe, and risks associated with general anaesthetic are often related to any other medical conditions that you have. Compared with a spinal anaesthetic, there's a high chance you might be uncomfortable when you first wake up in recovery and need strong painkillers. This may make you feel drowsy and sometimes feel sick. You commonly might have a mild sore throat after a general anaesthetic, and there's a small risk of dental damage. Serious complications are rare after a general anaesthetic and may be related to an allergic or adverse reaction to the medications given. For most people, the risk of serious complications occurring after general anaesthesia is 1 in 50,000 to 1 in 100,000, which is similar to the risk of serious complications after a spinal anaesthetic. Neither a spinal or a general anaesthetic provide long-lasting pain relief, and you will require other forms of pain-controlling medicines. With a spinal anaesthetic, the numbness will often last a few hours after the operation, so you'll initially be very comfortable. You will be prescribed regular medication, and additional pain relief is also available. Please ensure that you take enough pain relief to enable you to both mobilise and perform physio. In combination with a spinal or general anaesthetic, we often add a nerve block. This involves an injection of local anaesthetic around the nerves that supply the area of the operation. Whilst this does not take away all the need for further pain relief, it can reduce the amounts required and hopefully reduce some of the side effects. For knee replacement surgery, we commonly use an adductor canal block along with your chosen anaesthetic. This involves an injection of local anaesthetic in the lower inner part of your thigh. We use ultrasound to direct where the local anaesthetic is injected. You will not feel this injection as it is performed after the spinal or general anaesthetic is working. To summarise, the decision about which anaesthetic will be best for you will be made following discussion with the anaesthetist. Sometimes there will be a clear reason why one type of anaesthetic is best for you, but often it comes down to personal preference. Either way, you will be looked after by a skilled team who will do their best to get you back on your feet and walking again. On the day of surgery, you will come into the orthopaedic ward, which is station 16. You will be admitted by the nursing staff and meet the anaesthetist that will be looking after you during the operation. You will be prescribed some pain-relieving medications to take before coming to theatre, which will help to make you more comfortable after the operation. You are encouraged to sip water while on the ward prior to coming to theatre to prevent you becoming dehydrated. You will be collected from the ward by the recovery nursing staff and brought to theatre reception. The anaesthetic assistant will then run through a checklist with the recovery nurse and bring you through to the anaesthetic room. Monitoring will be attached and a cannula will be placed in the back of your hand. You will then receive your chosen anaesthetic and be taken into the operating theatre. After the operation, you'll be brought out to the recovery room for a short while before being taken back to the ward. We hope that you have found the information in this video useful to inform you of what to expect when you come for your operation. More information will be provided in the form of information booklets. Please feel free to ask questions about your anaesthetic when you meet the anaesthetist.